because we're 3 minutes left.
And she has money there's money in the meter.
That's all.
Yeah, you get going.
That's always what I say. There's money in the
We have a
meter.
deadline. Work's gotta get done.
Somebody ran into it, got stuck, I guess, on Friday. Yeah, so I think they just leave it up right now until it gets fixed.
There we go.
Mhm.
So we can't call, the bell was on.
What else needs
So
to be done?
the cameras are on.
Yeah, so I did turn it on.
Okay, we're good?
Yes.
All right, so we're gonna call the, what day is this? April 27th meeting of the Monroe County Board of Health call to order. We all got the previous minutes from about 3 different meetings in the packet. Did y'all get a chance to review those? Any comments, any changes, any questions, anything? Hearing none, I'll entertain a motion to accept the minutes as written.
So move.
Any
second.
Okay. That was Steve and George. Is Amy here?
Jamie is here.
Okay. You're hiding behind them. Okay, I just want to make sure, so you're a recorder of it. right? Okay, good, great, perfect.
I don't put your minutes in.
Okay, so our next thing on the agenda is public comment. I can't see this behind it. So you have to tell me if it says anything.
Okay,
Anybody there?
I do not see anyone.
Is anybody in the room? Public comment?
Yes, is,
Yep. Okay. All right. With none, I think the first thing we're gonna do, we're gonna change this around just a little bit, because we have our ladies back here, the Moms Demand Action people, and so you don't have to stand there and hold up the wall the whole time we're here. I'm gonna have you go next. So introduce yourself and,
Okay.
yes, thank you.
Alright, sure. We can all introduce them. I'm Molly Barwick. I'm with Moms Demand Action for Guns and America.
You'll have to talk just a little bit louder.
Oh, sure. Yeah.
This is the deaf end of the table.
Okay, my name is Molly Barwick. I am a volunteer with Moms Demand Action for Guns in America.
I'm Teresa Malone. I'm also a member of Moms Demand Action and actually focus on Be Smart for Kids, which is a gun safe storage program that we do here in Bloomington and Monroe County.
My name is Kathy Ruark. I'm a retired RN. I'm with Moms Demand Action because I think it's a public health, but gun violence is a public health issue. Crisis.
And we're here today. Lori, thank you so much for inviting us to come and speak to all of you. And we'd like to talk to you about our Be Smart program in that campaign. Like Teresa said, Be Smart is a campaign that encourages people to secure their firearms responsibly, keep them out of the hands of kids and people who shouldn't have them. We have been, well, Teresa and other colleagues have been doing Be Smart and spreading the word about it for 5 years now here in Bloomington. We've built great partnerships with MCCSC. So you'll see our tables that look like this at PTO meetings, at open houses, at festivals, at every public school, I think, in Monroe County. Is that right?
We try.
Try. Depends on we have a robust volunteer system that gets to capacity in the fall, especially. We also have a strong partnership with the Bloomington Police Department, and they supply us with gun locks like these right here that we give away to people who might need to secure their guns immediately. So these are free of charge. We also work with Riley Physicians. So you'll see our signage in pediatricians' offices as well. Go to a ton of festivals in the community. So trick-or-treating downtown, Fall Festival, Persimmon Festival. We talk with the Rotary Club, really anywhere where there are adults that are concerned about gun safety and kids. We try to get the word out. This program is completely non-political, and we find that people agree that we want to keep kids safe. So I was hoping if you have time, I could give you a short presentation with some data about gun violence and children, if it's okay. Is the PowerPoint ready?
Jamie, can you? Let's see.
Here's how I know. Where is it? Where's it say?
Well. I did not see it in my email
Okay.
address. Do you have, can you send it to Jamie, or can we log in with your laptop? And we can use your laptop?
Let's do that.
Perhaps we can set it up for the group here?
We can do that. It might need to be plugged in.
And Jamie, I need one of the notes that we went over, like the printouts.
Which one, what?
What do you need? The notes. Notes.
Yes, that,
This one, that's what you need?
yes.
Where do you suggest would be the best place to set
Right
this
there.
up? Right here? Okay. Yeah, let's log in around.
And these folders actually have all of, this is our table and all of our handouts, but these folders here are available for you to take that show all the handouts that we have, some other information. What we learned today, which is essentially sort of an overview of what the PowerPoint will be too. So you might want to take a look at that.
Well, while you're getting ready, can somebody tell us our strategic plan, what we have a strategic plan about gun control violence, gun violence prevention, there we go. And does everybody know?
I would have to defer
Yeah, I
to
think it's
Kathy on
been a while
that.
since I've looked at it, so.
I'm wondering if there's an ask
Is there
here.
anything in it about gun violence
Mhm.
prevention?
I'm wondering if there's an ask that you have for us.
Directly about it.
And maybe you could address that.
Okay, and would that be more beneficial?
I think so, because we have,
A lot of business and
we have all that here, so I'm wondering if you could
If it's
just
not,
think.
we agree with your mission.
Absolutely.
I don't think you have to convince us.
We want to keep the whole
Sure.
community safe, so that's not an issue, but I want to know what your ask is.
I think so we want to get this word out about safe gun storage and what that looks like specifically to as many people as possible. So what that looks like is securing a gun in either a safe or with a lock, with the ammunition locked separately. And not everyone knows that. They think that securing a gun means putting it in a high closet, and that is not the case at all. So defining what secure storage looks like would be something that we want to make as clear as possible to as many people as possible. To people who are not gun owners, we want to normalize that conversation about guns and making it comfortable for people to talk when they're sending their child to someone else's house. To be able to say, do you have firearms? Where are you keeping them? What does that look like? And have that be a normalized conversation. We want to be able to give away as many locks as possible, and that is a cost. So there is a limited number that the police department can offer to us. So if there are funds to purchase those through public health, because it is a public health issue, that would be an ask. And then also, I don't know your role specifically in this, but there are intake questions when you go to doctor's offices about, do you smoke? Do you drink well water? And we would like this to be a question as well. Do
I
you
have
have
to say
firearms?
something about that.
Mhm.
No, a pediatrician,
Uh-huh, mhm,
and it's right up on the list of things that pediatricians do.
right. Mhm.
But one of the things I used to do when I was in practice was I'd look at the kid and ask them whether they keep the gun. And these kids would tell their parents where they was, and their
Right.
parents would like turn white because they had no idea. Kids know everything.
Yes, they really do.
Yes, yeah,
They
so,
do.
so I think that's, it's amazing how, you think kids don't know stuff, but they know.
They do,
everything is now.
They do, and there's research that backs that up as
Yeah.
well, so the anecdote really
Sorry to
fits
interrupt
with,
you,
but
but-
no, I appreciate hearing that. So we would like to hear that intake question going to everyone, when they go for a health visit, and then a follow-up with it. So if there are guns in the house and they are not stored securely, that we could give someone a lock to be able to rectify that immediately. So,
But I think this, you would just ideas on how to make it more comfortable to speak to your family, your
Mhm.
children, your neighbors about guns, and to make gun violence prevention the norm instead of making reading the story in the newspaper and being upset, the norm. Just educate how to educate the public.
mhm.
Okay, so I'm still confused because as a board, we don't allocate money.
Okay.
That's number one. And we can perhaps support what you're doing, but I'm not sure as a Board of Health, what you want from us. Do you want us to support implementing your information in our public health clinic and our futures clinic? Is that what you're asking?
Yes,
Okay,
that would be.
that's what I need to know.
The most that
'cause-
we can get this word out to as many people as possible.
Okay,
Yeah, that's actually one of the questions, reasons I asked about our strategic plan, because I don't recall anything about
Okay.
gun violence prevention in our plan. So we redo the strategic plan, how often we review it on a regular basis.
Mhm.
And that's something we may want to just make sure we have, we address in our next strategic plan in terms of one of our priorities, because if you look at, the most common cause of death, and I have looked at the statistics, you may know them better than I at this point, in terms of causes of death, especially among adolescents, the top three, two of the top three are suicide and homicide. And those are almost all gun violence.
I mean, gun violence is the #1 killer of kids 0 to 17 in America. right
So,
now.
I mean, it's a significant
Mhm.
issue, so, and I don't know how we manage this. If it's not in our plan, we made a mistake not doing that.
Yeah, we probably have, but we could also, before we review it, we probably could be doing
Right.
some, directing the clinics or
Exactly.
asking them. We
Yeah,
don't direct them,
certainly
but
no
ask
clinics
them
having, do you know if it's in the?
To
your
include this
information
kind
in
of
the public health
information.
Clinic where they do immunizations on Miller Drive?
That would be a good place.
They did at one point take some information, but I don't know if they have it.
Yeah, it might be worth
Still
following
have
up
it.
on your part.
Yeah.
Honestly,
Miller
but,
Drive, okay.
and it's certainly in our futures clinic, we can have information.
Do you have a website?
BeSmartForKids.org is the national website with all of this information, including,
Okay,
great
yeah,
graphics.
yes or no was good.
Okay, yes.
So we could perhaps inquire, if it's not out of line, if maybe there could be a link to the website on the Monroe County Health Department page.
I don't know what links we can put on there, but that's not a bad idea.
I can look into that.
Okay, great.
I'll just add to that, I mean, I think through our work, we'll say that gun violence prevention definitely is sort of a loaded topic and an emotional topic, but when it comes from the voice of your healthcare, it's not so much, and people understand it kind of in a different tone. So we really appreciate your support with this.
So we're in our great organizational scheme. Whose responsibility? We have a public education area. Right? Yeah. Just looking at. it. So, where in the scheme of the organization where this. Whose
These would fall under
responsibility this might
Injury
be?
prevention, but I don't think we have injury prevention. Injury prevention.
In the schools, our school liaison
Mhm.
could give education on this and within the community events as well.
That'd be great.
Yeah, so it always works out better if somebody's there. So you can identify the best place or two for that too.
That's another.
And then that'll be-
Get it in there.
That's right. I wonder if might be something to consider.
And when we get to SB4, maybe
Sorry.
some of the funds that we may or may not get through SB4 might be able to be directed towards at least providing locks.
I think there is, I don't know if we don't have a lot of spare funding in our budget.
Well, SB4 may provide us with some extra
Well,
funding.
let me finish what I'm saying.
Okay.
But we do have.
Except they're probably gonna direct how we spend it,
Yeah, but there are categories.
and I'd be surprised in Indiana if they allow.
Yeah, so there are some, as I recall, there are some lines where we have a little bit of flexibility in terms of supplies and that kind
Yeah.
of stuff.
I think I have the original.
Supplies are always a problem, like in our clinic, we don't have a lot of spare money running around,
Right.
frankly, it's all dedicated to some certain line item.
Yes, I sent it to
Unless
you.
we can identify some line item, it's something we can think about as a budget priority when we look at the budget, that's one of the things that. In our budget, we talk about the budget in July, so. That might be something we can look at, if there's some spot in the. So who funds your cable lots right now?
Those are donations from the Bloomington Police Department. So they receive them and it's mutually beneficial because
Right.
we hand them out. They don't have the capacity to hand them out and we
Yeah.
don't have the funding for them. So it works well.
They actually come from the Firearm Trade Association, the National Shooting Sports Foundation, which is actually an arm of the NRA. And so the police department gets these and then we attach our card to them and hand them out, show people how to use them. It's like a bicycle lock.
Right,
Keep the key close to your heart.
yeah, this, yeah, I was involved in a research study about guns 20 years ago. And that's one of the things we did, is gave out table locks.
Yeah.
But we, and I, it may be the same funding source, we had a funding source for them.
Interesting. Yeah, I wonder. if
Yeah.
it's the same. Yeah.
I don't think the NRA is against it, safe gun use.
No.
That's one of the things they're against. They're against lots of stuff, but not that.
Mhm.
So,
Yes.
so, anyway, is there more, we need to get our meeting going, so is there more you want to share?
Nothing else unless you have any questions.
And I think that I appreciate what you're doing, because it is really important.
Yeah,
And
thank
the
you.
question is, what can we
Thank
do
you.
for
And
you?
good job. Thank you.
But if you have another organization that you're involved in, or
Thank
you
you.
can think of one, if you could
Oh.
contact Molly for it, we could always do a presentation or a brief talk like this, as well as, there's opportunities to set
I
up.
know I know you hooked up with
Information.
the pediatricians. Have you talked to the medical society about it?
No, we haven't.
Because
I would go there.
Monroe Owen County,
Mhm.
Monroe Owen County Medical Society, if you just Google that, you'll get their website.
Yes.
And there's a director, the director at myplace.org and Estate Burmworth, and you can see if there's something you can do to spread them, and they have a newsletter and things like that.
I appreciate that.
That might be a nice contact for y'all to make, because I think getting into physicians' offices and pediatricians are pretty good at this.
Yes.
It's the rest of them that don't talk about it. So,
And would anyone like a smart, because we want you to be smart? Always a nostalgia thing, right?
yeah. Thank you.
Thank you.
They're good for your
Thank
teeth.
Thank you for your time. I know
Thank
it's
you so much.
These are great for your teeth,
sharing.
too.
Yeah.
Initiative.
We should put pictures of the downstairs.
Yes, give them to the dentist.
Here we go.
Okay, public health reports. We have,
Sarah.
you up there?
Yeah.
I can't hear that.
No, no,
We know that we can't hear.
you are muted. No, you just
Not
don't have any
muted.
volume.
You're up there.
There she is, no volume.
She is muted.
It says.
Or she has got no volume.
Doesn't show this.
Should be unmuted on her end.
Yep. Increase your volume. No,
Still not hearing him. You can hear us, though, right?
She's not nodding like she can hear us.
It says you're muted on this end.
no.
No, it doesn't.
So
say
she's
muted.
muted. Now she's muted, now she's muted.
It's next to it.
I don't.
Should we go on to something else? If we can't
Oh.
hear anything?
There's nothing on there. probably. Yes.
Oh, where's
People in there.
where's-
Or check people.
let's move on to.
Oh, she
something
said
else.
she would call in, so maybe we can go back to
Yeah.
her.
Okay, and when you see her up there, let me know, please, you don't mind me.
Okay, she can hear us because we got
Oh,
a
you're-
thumbs up.
Kathy, I just wanted to tell you guys, Kathy was one of our regular volunteers at the COVID vaccination clinic. She just went in.
I recognize you, yes.
Yeah, thank you.
Thanks for coming.
Yeah, thank you. Okay, so. Now can we?
If we could do Kathy.
Okay, till she gets cooked up, we'll do Kathy, just gonna talk about the cigarettes, or how we're doing. That's you.
Okay, so what we're talking about right now is Tobacco Coalition and the Health Department have been working towards trying to get these cigarettes on the smoking ordinance, or actually try to be, or that's been our goal. We tried to take it in 2016, but it didn't go through, so we're gonna bring it back. Currently, we're doing a survey. I did check with the hospital before, they're the ones that actually put it up. And we still only have about 204 answers, so we're trying to get a few more supporters for this, and then we're gonna take it to the commissioners and speak with them. We plan to speak with them first before taking it before a formal. So it's still in progress, it's still going, and
Great, thank you. We just want to keep up, make sure that we don't forget about it. It got lost in COVID like many things, so. Things are resurfacing. Okay, you want to go ahead with your report, Lori?
Sure. So just a few updates with COVID vaccine. So the monovalent vaccine is no longer available. Just the bivalent booster. So the updated bivalent booster is now the only COVID vaccine being offered at the public health clinic. This is in accordance with recommendations from the FDA and CDC. As I'm sure you all are aware, the National COVID-19 Emergency Declaration expires on May 11th. The health department does still have free COVID tests available that we are distributing to the public while supplies last. Just yesterday, a multi-agency resource center was set up at the Steinsville Elementary School. They held this from 1 to 6 p.m. The Indiana Department of Health provided services on behalf of Monroe County Health Department for vital record services and Tdap vaccines. We are still monitoring the fungus Candida auroras. So we are watching just information on that. Let's see. To get into some section updates. So with our environmental section, the two the temporary position and the new wastewater. So they are continuing to onboard and learn, gaining lots of certifications in both of their areas. Doing a lot of the work in wastewater right now. We do have someone who is dealing with a medical injury. So both of those employees are working very well together with Mike to try to handle the wastewater load. Staff have attended multiple trainings. So with foods, they just recently attended the Southern Chapter meeting. Jessica attended the Indiana ANFP conference to speak on what the health department role is in food safety. General staff have attended the vector control training and mosquito control training. Wastewater hosted a new installer meeting here and attended the Indiana Department of Health on-site sewage systems program conference. Wastewater both now have laptops, so they are working to get those set up so they can actively use them out in the field to complete all of their work, to be able to upload permits and access everything that they need to in OpenGov remotely.
How are they doing it before?
Paper, so for the most part, yeah.
Had to
Very
wait till they
paper.
got back and then.
Mhm.
Okay.
I was gonna purchase 2 laptops, but fortunately TSD had some that we were trying out first to see if those have the capability to provide the functions that they need. And then we'll go from there as far as if additional technology needs to be purchased for that section. Let's see, foods is getting ready for festivals and summer inspections. 670 licenses have been issued so far this year. In March, 88 routine inspections were completed. There were 11 complaints in March and inspected 10 new establishments. Wastewater septic installation inspections have resumed. There were 2 sewage discharge complaints in March, 2 real estate inspections were completed, 6 follow-up inspections, and 4 repair permits issued. The general, let's see, so they're doing pool inspections, they're finishing up waste hauler inspections. In March, they completed 3 mosquito investigation inspections, 3 lead inspections, and 8 pool inspections, 15 solid waste. So the
You
lead.
mentioned lead.
Yes, I knew we were gonna circle to that.
How are we doing? Are we getting a?
Well,
Okay,
that
work all under
is
control
still
yet?
in progress, so I am still waiting to hear back from the state on the amendments that were requested from the commissioners to be added to the original grant contract. So the state is working with their legal department to make those changes. When I get that returned, I will take that back to the commissioners for approval, as well as the MOU agreement for the XRF machine. So we still do have the machine here. We're just not actively using it at this time. And I have created a contract. So if we loan that out to another county, they will be required by the contract. So,
The X-ray fluorescence is for lead?
yes.
Okay.
Mhm. Which Mike has now completed the lead inspector and lead risk assessment certification. So he's been going out with Coney and Simeon on some of those inspections as well. Let's see, Mike has also completed the health equity training and Presby certification, and he'll be completing the certified pool inspector license in May. For our disease interventional specialist, they have started doing testing in Clay County Jail in April. They say that the medical staff has been very supportive. They're requesting that staff attend once a month for testing. Our staff are trying to work with our local jails so that they can establish monthly testing inside Monroe County. So they have been actively reaching out to try to set up an appointment to get a system in place for that. Public health preparedness. So 38 hours spent in March on COVID-19 planning and coordination efforts. The COVID-19 school liaison has been assisting with the school catch-up vaccination clinics. He attends this with our public health clinic. And
Do we know how we're doing with that?
with
How
the
we're doing, getting caught up? I know.
as far as I know, I think they're doing well. Zara, might be
Yeah,
able
we can
to
talk to Zara.
speak more to that. But from my understanding, they're busy, and
Yeah.
having him as a resource has been very helpful.
Yes.
And preparedness, has been helping to, coordinate our upcoming, staff retreat. So that has been extremely helpful in trying to find information, on where that can be hosted and costs and contracts. So busy with that. Population health and outreach. In March, hosted 20 tobacco cessation related events or programs. 114 hours were spent on harm reduction. Linnea completed the annual report. So it's really put a lot of time and effort into that. So we're greatly appreciative of that. And staff attended Addicts Awake documentary screening in Brown County.
So Linnea did the report. Explains why it's so beautiful.
Yes, and Kathy.
But yeah, but I've worked with them both in terms of when we work together. She does beautiful
Mhm.
work.
She did a great job.
She's got a gift.
Mhm.
She's got a gift.
Yeah, she does. That's impressive.
For vital records in March, 548 birth certificates were issued, 720 death certificates. The new assistant registrar is onboarding, is going very well, learning and actively working, and was able to help provide coverage while 2 other full-time staffers attended a vital records conference. So that is all going very well. For our Futures Family Planning Clinic, let's see, 32 patients seen in March. The clinic is still operating at half capacity right now. We are still onboarding our new nurse practitioner. Peggy is staying on to help with that process. But until we get that fully going, we are still just providing patient care 2 days a week. But the numbers still seem to be pulling in well, even after
Peggy
operating.
was the one that was retiring. right?
Yes.
Yeah.
Mhm.
Do we ever telehealth things set up or?
So Eric is still working with the PACE clinic on that, and now we need to get the new nurse practitioner certification so that she can conduct those.
And when the new
visits.
nurse practitioner actually going full-time when?
She is full-time now.
Now, so they're just overlapping and,
Mhm.
perfect.
Yep.
That's great.
Yes,
What's her name, the new one?
Emma.
Emma. Okay.
Mhm. And we have the new LPN. So they're doing both well. They're really excited to do outreach. They just hosted an event at the Healthapalooza recently at the school, so they really enjoyed doing that. And Eric is the number one thing, a large focus is trying to reduce the number of no-shows. So those volumes still kind of high, but again, consistently getting out those text reminders, appointment reminders to try to reduce those numbers.
Yeah, no shows are really high in the population.
There's a problem in the two FQHCs as well, about 20% at least.
So when I did both baby clinics, it was like 50%,
Yeah.
until I started calling the day before, and then it was only like 20.
Then just 20%. Yeah, it's the population. that
yeah.
Yeah.
Well, it's, they have other things to think about sometimes.
So that went well. They have completed onboarding now that we have the new nurse practitioner and training for the Path for You program. So if you'll remember, that contract was signed a few months ago, but now that we're getting established with the new nurse practitioner, we're going to start trying to actively participate for that. They will set appointment blocks in the clinic. They're just going to start out with 1 day a week right now for Path for You patients. And again, that's just funding with Indiana University that can provide contraceptives at no cost. So hopefully I think that'll be really good.
As I recall, you said there were a couple people out for a brief period of time in the wastewater area. Was that correct?
For the conference.
Oh, maybe just the
training.
conference, okay.
Oh, mhm.
Well,
So-
yeah,
And
that's
medical-
separate. Yeah, medical issue.
Yeah.
Yeah, well, yeah.
Yeah.
So what are we running now roughly for septic inspections?
Oh, for turnaround time? I could get you those exact numbers. I might defer to Mike to see if he has.
Well,
We get
Any
a
idea?
complaint in, it's probably 30-day turnaround.
Okay, all right. Well, a lot better than it used to be.
Yeah, that's within the state guidelines.
Yeah, yeah.
They're coming in. We're getting,
Has there been any new
Yeah.
news on the ground penetrating radar for the septic folks?
Not that I am aware of. I can touch base with Shai on that. Mhm. Okay. So I think that's my updates.
Any other questions? Have we gotten Sarah yet?
Sarah, yeah.
Still there, we can see her. but
Oh,
it's
it
still
looks-
has the whole thing on her.
Let's see.
She's the phone number, so.
Okay.
Hello, can you guys hear me?
Hey.
Good.
Awesome. Thank you for the patience with that. I apologize. I think it's my computer settings. I think that's what it's coming down to. All right. Oh, it's going to put my phone number up there. All right. So yes, I'm Zara. I am the clinic manager over at the Monroe County Public Health Clinic. I've got quite a few updates. Let me know what questions come up. So under immunizations, as Lori mentioned, the CDC guidelines changed last week. So we have adapted those new guidelines. So no monovalent vaccines are being given at the public health clinic. And an additional bivalent vaccine dose was approved for those 65 and older, as well as people who are immunocompromised. So we have seen a slight uptick in our schedule, but nothing too crazy. Definitely not what we were expecting, if I'm being honest. We will continue supporting assisted living, nursing homes, long-term care, et cetera, with clinics at their locations when that need comes. For this first quarter, we had 577 encounters with 535 total vaccines given. 547 of those encounters were residents of Monroe County. We are wrapping up our spring school immunization program. We had a couple of schools that had to go to remote learning, so we had to readjust the dates we were going to those schools. So we will be wrapping up by Thursday of next week, which is pretty crazy. It flew by this spring. If students at the remaining 3 schools are present the day that we go next week, our total number of vaccines given in the schools this spring will be 212. We offered Tdap, MCV4, Menactra, HPV, and Hep A for 5th and 6th graders. And for the 11th and 12th graders, we offered Menactra, MCV4, HPV, Hep A, and Men B instead of that Tdap. The total number of kids that received at least 1 vaccine in the schools was 97. So we had a little under 100 kids participate. That's it on immunizations. Under communicable disease, right now we have 16 open communicable disease cases. We closed 4 this week, so we made some progress. We have 8 open lead cases, and we closed 2 in that quarter, in this first quarter. And then for TB, we have under 5, and we're hoping to have a closure this upcoming week. So doing pretty well. Speaking of TB, we did just recently hire Tamara Fitter. She's an RN. She has accepted a public health nurse position with us. Her official start date is May 22nd. That's a Monday. And we're really looking forward to her joining our team. She will be handling more so the TB and LTBI workload, as well as vaccinating in the clinic and continuing to support outreach and all the amazing things that our public health nurses do. Safe Sleep, that's another program that functions out of our clinic. We do service all of the Southern Central region. That total has been 131 cribs distributed, as well as education provided on Safe Sleep. In Monroe County specifically, out of those 131, it's been 56 Monroe County residents. And for outreach, on top of our school immunization program, we have also been doing some wellness events in the community. This quarter, we have screened 53 participants for high blood pressure. We've done 31 diabetes screenings. That does include a fasting and an A1C screen. And then we have done 20 cholesterol screenings. So pretty good. That is all the updates I have. Are there any questions?
Oh, yeah, the one question I have is it has to do with the catch-up immunizations, how we're doing the catch-up immunizations. At this point, are our rates getting better, or, and do you know what our county rates are?
I do not outside of the school immunization program, but I'm happy to get those numbers for you.
Yeah, I'm just concerned that we get caught up on all that. It's been a while after COVID. So, if you maybe let us know next time what our rates are, our county rates are. That'd be great.
Okay, yes, I can definitely.
Great, thank you. Anybody else have any questions for Zara?
No, thank you.
A lot of information, thank you.
Yeah.
Okay. Now, carry on to old business. Christina.
Would you mind if I?
Yeah, please,
around
actually, that'd be
for
great.
order?
Yeah, that'd be great, actually.
Thank you.
Now, turn around and.
So there's 2 handouts in your packet. One just says preparedness health board info, and then there is a colorful kind of chart in there as well. And my name is Christina Kemp. I'm the public health coordinator with the health department.
There's so many pages here.
But if you look for the colorful one, it's probably
Speed.
just kidding. Front and back. Okay. Is that it? Save and patient.
There we go.
So, you know, to get better,
Oh, here we go.
Okay,
did you all find it?
we got it.
Okay, so to get better, we have to look back. And part of that, you know, it's a while back, you had received a copy of the COVID-19 after action report. And so what I had talked to Lori about some things and, you know, just trying to brainstorm and look through there and look at different topics. And she had asked me, one of the things that came up that I had a lot of concerns about was the staffing portion. And so she offered this opportunity, so thank you, to be able to present this to you. So I'll be starting with this part first, if you need to follow along with that. Just a brief review, because I know some of you weren't here We hired Resilient Strategies to help us complete this very extensive, comprehensive after action report, which I'll say AAR going forward, and improvement plan, so IP. It went from, let's see here, January 24th, 2020 to March 1st, 2022. We also did about a 6-month midway after action report that the state had required us to do as well. And so some of that wasn't necessarily captured in here, but I will refer to a few things. During this time, we not only surveyed health department staff, health board, but also all of our community partners. It went out to about 1,400 different agencies and individuals in those agencies. So long-term care, childcare, businesses, restaurants, faith-based communities, not-for-profits, universities, hospitals, so forth. People were also given an opportunity to do a virtual session. So if they felt like filling out the survey wasn't enough, they could also do a virtual session and be able to provide a little more input as well. And so we had this, it was given to us, completed June 7th, 2022. So again, I said, I'm going to just focus on staffing areas. There's lots more interesting reading in here. And the topics I'll cover are termed incident sectors in the AAR and IP. So it's just basically various specific parts of this incident of COVID-19. I will specifically talk about strengths and areas of improvement, but with more focus on area of improvement because that's the areas we need to work on. And so first, I want to say that, despite COVID for everybody across the board was such a huge challenge. I mean, I had no idea. I feel so like looking back, just so naive being in preparedness, like I had no clue it would just be to this extent. And so I think most of us were caught off guard a little by that. And I think the health department should be extremely proud of our response. And so what I'm saying here, like some people may take it and be like, kind of offended maybe or hurt by the things, but it's not about pointing a finger to any one particular person or division or even health department, because I have communication with other health departments who, for some things, experience similar things, others maybe not so much, but during this time, we strengthened our partnerships, we improved our skills, we learned so much, and I am confident that by passing this information along to not only you all, but to also our new staff and to partners that we, continue to interact with, that our community will be safer and more ready in the future. So the first one I'll focus on is internal communication. And so strengths would be in virtual communication for meetings and collaboration. Actually at the very beginning, we didn't have that, or not that I remember anyway. And so that was a huge thing for us to be able to have, and that we still use today. We do have some restraints with having Zoom meetings. Maybe not everybody can just what's the word? Not instigate, but can initiate a Zoom meeting. But we now have Teams, and so Lori has told me that may be something that we now all have the capability of doing. Areas of improvement, though, this was on, if you do have a copy, and if not, we can provide you with electronic copy on page 17, was starting the areas of improvement for internal communications. And one of the things that I found very kind of like, wasn't surprising at all, but I was really pleased to see it was numerous staff requested more visibility of overall operations and goals. So to me, that was a positive because staff wanted to be more engaged. They wanted to be, we don't work here for the money or the prestige. We work, I know, it's shocking. We work here because we care about people. And so for staff, it's not surprising, staff wanted to know what's going on. They wanted to know what the goals were, and then therefore, how could they be a part of that? So one of the things that was decided was to develop 2 or 3 communication plans based for large scale events, and kind of breaking that down. And this is not in the after action report. This is from me and like what, conversations and so forth. But involving more staff at the beginning of the incident, because, it's like, once you get behind, it's hard to catch up. And then once, like Kathy, I'll give her an example. Kathy's great with like the statistics. So once Kathy's like going on the statistics, she's like the person we go to. That's, we just kind of, and I think a lot of things kind of happened where a few people became the subject matter experts, we'll say. And that load wasn't shared where the staff was, willing and excited to do that. Also using the incident command system for any future large events, which honestly, I find like, on one hand, I think, yes, this is perfect. We have an incident commander, we have operations, planning, so forth, the logistics. But working in a health department setting, it's hard to do because we're not a fire department where it was originally intended to be used for. So I think we have some figuring out to do on how we can best use staff in those positions, but also know what staff can be keeping the health department running, and being able to do both at the same time. Microsoft Teams is going to be probably very essential and helpful. And then I'm just kind of looking at some other project management tools that some seem very complicated. So I don't know if that'll ever be the case, but during COVID, we had things with schools going on, long-term care, businesses. There was so much information and none of us could keep up with all of it. We tried different ways and it was just impossible, but being able to have some way where we could all look at it and be able to kind of get a grasp on where we were at with different things would really be helpful. The next one is local coordination, decision-making and strategies. This was page 18 from the strengths, and the weekly virtual meetings led by the public health officials was something that was mentioned by a lot of people. And so I think the community really appreciated being able to have all those different viewpoints and a solid message together. Also contracting of a security service to help liaison between businesses, restaurants, and the county was really a strength. And something we had not, that was something that just kind of developed. And I don't even know how it actually developed, if it was Penny or who had decided on that, but it worked out very well. And then also giving credit to the board, the science-based decisions and not letting political aspects impact health mitigation efforts. And so that happened in a lot of counties. And it's sometimes really surprising when I hear what my counterparts went through that I didn't have to experience. I mean, it was hard, but there were things that, because it was handled in a way that it's science, and that we didn't have to worry so much about, at least for and those who answered the political aspects. Areas for improvement, incident management. This isn't just for the health department though. This is really like, I would say probably every single entity that dealt with COVID could probably say they could have handled the incident better and differently. They would have if they had more information as we do now. Many disciplines discuss how broad the scope of emergency was, how daily things that you would do just every day suddenly halted. And so it was just like hard to adjust and figure out, how do we manage this and how do we pivot? Because sometimes it would look like things were getting better and then we would hit by another strain and so forth. So the company that helped us with this resilient strategies recommended increased familiarization with the incident command system and incident management fundamentals. As I said, that's hard sometimes in the health department, but I think there are some really valuable lessons that we can learn. And that's something that we're thinking about and looking at not redoing, but looking at which staff are in that incident command system and, who has the skills that role needs and who actually needs to be running or overseeing that department to make sure those needs are being met as well. Let's see, there's also, as new reports come out, there's probably going to be a lot of lessons we can learn from there. There was a new one I just saw on the news, lessons from the COVID war. That sounded pretty interesting. The one thing that's also really valuable for for us as a health department is just going through this event, even though it was much larger than what we thought we could have ever handled. There's no education like going through it. And so now I know Kathy and I wish we could go back almost and see, you know, those first few days and now, you know, how we would think about things and look at things. So we did do a really good job, but it's important not to just pat ourselves on the back, but to really dig into the after action report, look at what happened and make improvements. So again, it's not to point fingers or place blame. And I feel like sometimes the people they want to know that everything was perfect or think that everything went right. And then that's where the problem lies, is like not digging in and making, you know, addressing this. So another area of improvement for local coordination, decision-making and strategies was task management, visibility and situational awareness. Kind of goes back to the first thing, but staff, you know, they knew what to do on a daily basis with their normal jobs. But during this disaster and larger emergency that we may face, their scope of their tasks changed. And so it was really hard to know what to do in some cases. So having some kind of shared visibility tracker, that's kind of goes back to that project management tools to help everyone maintain situational awareness, not only with COVID or whatever may be next, but also with wastewater and so forth, because staff may have to be moving around. And so trying to keep that situational awareness forefront. One of the things that looking back now, like, yes, this makes a lot of sense, but developing a list of jobs or positions needed in order to scale up quickly for an expanded event. While again, keeping that minimum health department, you know, everything's functioning. And, you know, one of the key things that happened during COVID, and it happened, I think maybe about, I don't know, 11 months in or something, is when Penny and I'm sure you all decided on hiring complaint takers, what we call them, complaint takers. That was a game changer. They handled so much that we could not handle. It felt to me like a sinking ship as we were trying to not only move forward with things, getting testing sites set up, communicating with the public, with the media, answering questions from every entity, it seemed like, in Monroe County. And then suddenly there were like these 4 people appeared and we were able to hand them something. And it was wonderful. I mean, there were things with that, you know, Kathy primarily coming up with trainings for them, getting them set up with everything, me doing their scheduling, but it was like we were able finally to hand over something very specific. You do complaints, and then they actually ended up doing the hotline as well. We did have a part-time staff who had volunteered to answer the hotline, which we'd set up. That was another key thing during the response. So keeping in mind, like, what other positions may we need? And so it may not be something that we actually have to hire out for. Maybe we will have money like COVID, or maybe we won't, but just knowing what those roles are. One thing that was difficult, and I'm sorry, I'm trying to speak fast. I just have a lot I wanted to get in. It was difficult communicating with the public health clinic because we're 2 different entities and we use 2 different systems. So whereas they were using Teams, at that time, we couldn't use Teams. They couldn't use Google Docs, you know, so we tried. And in the end, it was like, we'll just do the best we can because there's just no solution at this point. So we do now have a way that we can communicate through Teams. I think we probably need to look at expanding some more staff have access to that. Like, we have our health department Teams, but it's like having access with the public health clinic team so we can be ready. Another one, the last one is staffing. And so strengths, leadership and staff performing new tasks and unfamiliar, I can see I'm being tongue twisted. Responsibilities to provide the best safe practices for the community. I can't go through all the great things that happen, but I'll give a few examples. Foods, very thoughtful and compassionate communications with their food establishments. Like there was really a connection there. Various staff throughout the health department being involved with complaint inspections, vital records, answering questions that, you know, they're normally not answering types of questions like that, but we would provide them information, you know, here's, if someone asks this is what you need to say. They stepped right up to do that. The MRC coordinator scheduling all the volunteer shifts for a really long COVID clinic month. If any of you have ever tried to schedule volunteers, it's a very challenging job. And to do it for the amount of people we needed and for that long of time was amazing feat.
Can I just say, she was so amazing. I'm on the MRC and I get those notices. I couldn't help because I was working the response for CDC, but I was like, I would read them and I go, how is she doing this?
Yeah.
It was so impressive.
Yeah,
It was awesome.
and
Sorry,
it could
keep going.
It could be a really frustrating role because, you know, people's schedules change and they're volunteers, you know, you're thankful for them. And so, you know, of course, it's no criticism, but you know, things would change and they'd have to go back and redo, but yes. Environmental, doing things, even like helping me fill cleaning solutions to give to long-term care facilities and breaking down boxes, like that was huge. That was a huge gift almost to have help like that. They also did sports plan reviews, wastewater, picking up and delivering handmade masks, harm reduction, just always being the first to offer their help. The administrative assistant sharing important information in a timely manner through social media and so forth. I'm sure I've left people out. So that's what I really want to stress is that we have incredible staff, and I know staff have changed, but we still have incredible staff. They maybe didn't go through COVID, but you can already, like, I can already see, and I don't have a lot of interaction with upstairs, but that, you know, that everyone would pitch in to help if they're allowed to do that. Also a strength MRC providing thousands of hours. Literally, I was trying to look it up. Kathy, I don't know if you know offhand. I saw like 4,000. What was it?
I think it's over 1,000 if you look at all the together. But
Okay, I was like, I saw 4,000, but yeah, I guess that may be. I have to do the
I
math.
would have to look.
Yeah. But then, so, you know, focusing again, areas of improvement. So utilization of staff during disasters and emergencies. So I think this is the big one that I really wanted to hit on. So in the report, opportunities to augment, amplify, maximize staffing in response to COVID and future incidents can be enhanced. During disasters and emergencies, many normal daily activities and tasks may no longer be what staff are assigned to carry out. Some may need some modified just-in-time training, and assignments of alternate roles may be considered. So in the report, using organizational charts to determine staff availability. And then, so one of the things that the handout here is what I want to kind of go over this. So looking at staffing, and again, this is just pulled from timesheets. It's just data from the first 10, well, the 10 weeks that the county shut down and that the world kind of shut down. And so I wanted to look at this in detail because I fear, I know a lot of people would not agree that a shutdown, they just say that will never happen again. I know, like, I don't feel that way. And maybe being a preparedness person, I'm like, worst case scenario, I just want to, because I never imagined it was going to be that bad. So I want to be ready. But basically, I think this is where a lot of the things where areas of improvement could come from. And it's just how we utilize our staff. So in this first column here, it's just the division. And it's basically each row is a person. And so, like, you know, that where it says number 2, preparedness coordinator. I'm sorry, it's their division. And so you kind of go down there, and then the next to that is their role. So whether they were a section lead, administrator, staff, part-time person, like what their role in that division is. You'll see claim 8 through 12. These are just 2-week period of times of when that's how we get paid. You'll see the hours worked for the 10-week total. And then the weeks are down here if needed, this little box at the bottom. And then, and so they're in order by hours worked. But the key things to look at are the last two columns, the emergency hours, which is paid to full-time people. It's paid time, but they're not working. This is under like an emergency, it could be like a snow day, it could be a public health emergency, whatever. And then the actual overtime hours worked. So you'll see, that at the bottom of those columns, the emergency hours equal 1,308. Whereas the actual overtime hours are 651. So by spreading out those job duties, we could have involved everyone, which they were interested in, spread out the stress, spread out the subject matter, experts will say, and really had that all hands on deck team approach. A few things here too, just keeping in mind that when I think about public health emergency, it's like, this is our, what is it called? Like a 5-alarm fire. Like this is the big, is it 5 or 4? I can't remember, but this is a big one for us. Like public health emergency, it should be all essential that we are all essential personnel reporting. So just a couple things to look at here. You'll see that not the public health nurses, but our nurses are down here at the very bottom. Futures being under whatever grant.
Title 10.
Title 10, like they're not allowed to participate in a public health emergency. So, yeah.
Okay, that makes sense.
Yeah. So, it's really frustrating. You have a nurse practitioner. There's 2 listed here because there was a change, there was a switch and stuff. But you had an LPN and a nurse practitioner who, 229 hours of time during that 10 weeks that could have been used to the response. And I'm not saying that the staff asked to go home. They didn't. And I don't know where, that decision is way above my pay grade. I'm just saying, like, from my perspective as the public health preparedness coordinator, this would be an enhancement to what we can do by looking at this. Other things here, let me see here.
So let me ask, this makes no sense to me if you have,
It's federal.
huh?
It's federal.
It's what?
It's federal. It's the
This
state.
makes no sense.
Well,
They
it's
don't,
federal.
it's federal. Well,
Okay.
But they must have a reason. I mean, they're,
because they want them to be doing only family planning work under Title 10. So they're prohibited
Can do
even
anything else.
from doing, for example, STD related work. I ran into this all the time.
Yeah, no,
They have to be working for Title 10.
it makes sense when you don't have a public health
family
emergency.
planning, STD.
And it seems like, that's something that some lobbyists out there ought to be able to deal with.
I agree.
Yeah, that they should
Should have been somehow.
I mean, we had a public health emergency, the rules are different.
It should have
When it was
been.
written,
Yeah, yeah,
we didn't have this, so
yeah,
it's about lobbying
yeah.
the legislature, which is going to be impossible anyway, to change
Yeah.
the legislation. So
Is there
that
trying to
there'd
get
be
federal
more,
government to
there'd
do
be
something?
some flexibility, but that's.
Okay,
So Lori she was really thinking outside the box, something that I'd never thought about, like, maybe looking at, can those people, because they were at home and, it does not take the whole future staff, all the staff to maintain like, phone calls that could they be moved to another, I don't know, is it line item or whatever it's called, but to pay them out of that to allow them to work or.
Like an emergency fund that's reserved in the budget.
Yeah. and it is, because, when you look at this, it's very clear what happened, and it was obvious to all of us who were there what happened. You two and Penny did all the work. Well, you did a lot of the work, but I said, you guys worked ridiculously long hours.
Yeah.
And I mean, and you guys pulled it off. I mean, you guys did great.
Thank you.
And maybe there's no way it could have happened if the 3 of you hadn't, I mean, I realize lots of people did stuff, but you guys really went above and beyond the call of duty and.
And I think, I didn't take time to pull like the next, but overtime continued for, kind of kind of me, Kathy and Penny. And food's a little bit on Nicole, being the manager at that time. But, yeah, it just, I'm glad you see what I'm trying to say, because I'm not trying to be, I'm just trying to present the facts, and like, we have so many intelligent people here
Right.
that it's like such a shame to not use them. And like I said, once things get started, it's like trying to jump onto a merry-go-round, you know, it's hard to do, and it's frustrating, and, you know, we only knew things because we were there from the beginning. We didn't have any magical information.
Yeah, and the other thing that happened during this, which I think is what's most commendable about how well y'all did, was the fact that the rules changed like weekly. In terms of the information CDC was all over the place. And we still managed to do it, and I just, you know. And
It's almost unbelievable.
I know, it's just,
Looking back,
Yeah.
I don't know, but it was definitely, I don't want to speak for anyone else, but it was a scary time. It was a lonely time, because there wasn't anyone around, and we would leave in the evening, and it was like a twilight zone. There were like no cars, there were no people.
it was very strange.
Yeah.
It was extremely
And
strange.
so that's why I'm like determined. I again thank Lord for letting me speak about it, because I don't know that I'll be here during the next time, but I don't want the next person or any of my counterparts to go through something like that.
Yeah, that's what emergency preparedness is all about, being prepared for something you don't expect. We certainly did not expect this.
Right, absolutely not.
But I think your thoughts are really wonderful on this in terms of staffing. I think that, you know, like you said, there's a lot of really intelligent, dedicated people who work here,
Absolutely.
and
Who have,
who are
yeah.
willing, I'm sure they were willing to do things if we just had a plan.
yes,
And,
Yeah.
you know, so now that we've been through this.
yeah.
People were cross-trained, which I think we talked about before,
Mhm.
right?
Nothing like a
Training.
crisis to point out your
Cross-training.
shortcomings.
Right, cross training, we love cross training. So, yeah, no. Good.
So,
But
and I will
prepared.
finish here really quickly. I'm sorry I'm taking so much time. It's just like, I wanted to present all of it so you could understand what.
Well, I mean, I've read this whole thing and it's really interesting in terms of,
Good.
Yeah.
And just, you know, one thing too, like when there's managers having far fewer hours than part-time people, just looking at those kind of things as well. So overall, just expanding the team, kind of whatever that delegation of authority, that was another area of improvement. That's just something we're gonna have to figure out, because it's hard when you're using like, maybe using ICS or using our normal supervisor system. And then lastly, compensation, overtime, and mental health concerns. And so in the report, as the public health emergency lingered on, many staff members continue to fill critical roles with expanded responsibilities. And so I want to just be the first to share, like, if I did, and probably still, you know, it had a large impact on my mental health. And that's why, whereas I hate to come here and not just be like, oh, this is going great, and this is, you know, I would rather come and talk about that. But I think it's important to say it was hard, and there needs to be, even though we have an EAP, we need more information about that maybe coming out on a regular basis. We need more, maybe just people checking in with us. You know, just to make sure, because there were some really dark days, and I'm sure for lots of people. And so just as a community and as a health department family, I think we have to look at that. So I'll leave it there. Are there any? Sorry, I took up like way too much time.
No, you didn't. No,
Yeah.
it was interesting. Yeah.
But one more quick thing was about compensation that did come up in the report. It's kind of a tricky thing because, you know, when you work on extra, like hundreds of hours, do you need the pay or do you need the time off? And I think that changes from person to person, and it changes from time to time. Because I was paid for some hours at the very beginning, and I really appreciated that. And then I needed time off. But the thing is with taking and kind of being a little bit pressured to take time off, because, you know, the county doesn't want you to leave or something and you have to get paid for all that. If you take time off, you get more behind and it adds more stress. And when you're doing things like setting up clinics or working on vaccination, you feel kind of selfish if you want to take time off and then others are having to wait. And, so that's another consideration, but I just wanted to mention that because I think that plays a big part in it too. Any questions?
I
That
want to
was
personally-
fascinating.
Thank you.
I want
Where
to
do I
personally,
get a copy?
I'm
Where do I
sorry.
get a copy?
I'll get you one. Thank you.
I want to personally thank you for your perspective on what was going on last fall. That letter you wrote was very helpful.
Thank you.
Yeah.
Thank you. Well, my heart, I get frustrated with public health. Sometimes I think everybody does, but my heart is in it and I just, I want the best for this
I
department.
think your passion shows and just the sound of your voice and how you speak about this. So
Thank you. I appreciate it.
Thanks so much.
Thank
Thank you for
you.
sharing that.
Yeah, and I'll have them send a PDF if that's okay.
Yeah. Thank you. Okay. We have Joe next.
Yes, and I'm not seeing Joe.
There are a bunch of participants. Have they not been elevated to the panel yet or?
Joe, are you here?
Click the participants and see if he's there.
Let's see.
There's like 11 participants left there. So he's only-
It's right to the left, so.
Yes.
chat, so
Oops. So, here's our attendees. And then here's the panelist and then attendees. I can provide just a brief
Okay.
overview though.
Right.
Yeah. Okay. So with, this grant cycle for, our COVID funding, we've decided to take, a chunk of it. So essentially, schools in the area were asked, to either opt in or opt out, whether they wanted to receive a portion of the funding that would be distributed. What we asked was for the schools who wish to participate to submit project proposals. That way we would be able to have an idea, maybe where some of the funds were going to be used within that school, while also giving them the ability to dedicate some of that funding to specific needs within their individual school.
How
So-
much money are we talking about, Lori?
240,000.
Mhm. Yeah, so it ends up being 26,000 per school has opted in, and then
And some schools are bigger than others, so how do you do that?
yes, so we do have a chunk that's left that we're trying to figure out if we're gonna do it based on that size to divide it up. And we're trying to make it more equitable this time around, whereas last year, the grant cycle, it was just everyone got a solid chunk of funding. So that did factor into where some of the larger schools are going to end up getting a larger portion versus some of the smaller schools.
isn't Monroe
Um,
County, I mean, it's much bigger than any other
Yeah.
school system, right?
So were there criteria as to what this money can go for? Because these proposals are all over. the
Yeah, they're
place.
all over the
They
place.
really are.
Right, so really, it just has to be something that they are looking to improve or an actual need that they have identified within their school that they maybe need replacement. That way, they could have that sense of ownership, but they don't have the actual funding to be able to dedicate that money themselves, but it's something that we could help provide to them.
So, I mean, because there's things like, from, HVAC systems to playground equipment
Mhm,
and everything in between, so.
Right,
There was the one letter that actually gave the letter of intent, which explained what was possible. That's actually in there. It was part of, was that Harmony's proposal, I think? It was the first page of
Yeah,
theirs.
the one was,
And the letter was there so that you could read through what people were supposed to be addressing. I'm just wondering who is actually making the determination of how this money is divided up and
mhm.
who gets what and what actually fits the criteria that we outlined for this proposal.
So these all have to be submitted to, so they're reviewed by our legal department
Mhm.
and then they're submitted to the commissioners.
Okay.
So the commissioners,
make that
yes.
determination. Okay.
So
Everyone to know.
these are all just really drafts
Right,
of work and that will be presented to the commissioners for their review and approval.
great.
So
That's
who
what I wanted
decides
to
how
know.
the money's
Thank you.
divided up?
Well, that's actually up to the health department. So we decide, well, because it is with that funding, so we do have enough money for our school liaison, for training travel expense line. And then what we wish to do with the remaining money is up to the health departments. But it does,
Something we have, the board needs to do about this, or just something y'all do,
this is something that we do.
so we don't have to make any, this is just for our information.
When I
Correct.
looked at it, there was one that it caught my eye, and it was when they asked for an AED, and I thought, does every school have one? We should.
Well, they asked for two, I think, and the other one that caught my eye was like, do they have a bleeding problem? And it's like, wait a minute, do you need that? Do you have somebody who's a hemophiliac who attends the school? I mean, I was surprised at the number that they were asking for and like, what's been going on at your school? Really, I was shocked.
What are you doing in that school?
Yeah, I mean, I think it was St. Charles, and I was like,
Yeah,
what is happening over there? I was just really curious because they had two sets of requests around
and
that.
next be prepared for the next big lead.
But it's too bad we can't come up with something.
Yeah. Okay, so that's just information, we can move along.
Yes, just,
Supporters?
just information.
You want me to go put it in?
I'm gonna stick it on this, thanks.
Okay.
It may take you a minute.
I can give you some pointers to do.
That's okay.
Somebody will run out and do it for you. I know where you parked. Okay, so we'll go,
To do that, and then I'll-
so we don't need to make any action on that one then.
No, so just know that,
Okay.
yes, this was in the works.
And it's still on the code review. We did this before.
So this is, so Mike is
Nice,
going
nice.
to share with us.
Look up here quick, I'll see.
Yeah.
People behind me makes me crazy.
Oh, okay, yeah.
Open share. Join us.
There we go.
Hello, I'm Mike Zimko, the Monroe County Health Department Environmental Health Manager. Is this for the update for the multi-license?
Yes.
Okay, yeah, on March 29th, commissioners voted unanimously to implement a multi-market license for farmers markets in Monroe County. The multi-market license will be an annual license starting March 1st, 2024, coinciding with issuing our 2024 retail food establishment license. The multi-market license will follow chapter 341 AC. 341 states that a license for retail food establishments shall be for a term of 1 year, beginning March 1st and expiring on the last day of February of the calendar year, and shall be renewed annually. With the multi-market license, a vendor can participate in 1 to 3 markets for $100 or 4 to 6 for $200. Current vendors wanting to sell at farmers markets.
They got it this time.
Yeah, we're chipping away at it.
We're good.
Yeah.
Current vendors wanting to sell at farmers markets need a 9-month seasonal permit. A seasonal permit for a license for vendors for farmers markets are only for select markets. 1 is needed for each market location. Also, a seasonal permit is for anyone who wants to operate for 9 months at a fixed location or address throughout Monroe County. So we need to keep that seasonal for those vendors. The seasonal permit is needed for vendors that want to operate at fixed addresses outside the farmers market. These are vendors only operating during like IU football games, like the Bloomington Speedway, like they're not operating for the full calendar year. Since the seasonal permit is only good for 9 months of operation, we'll adjust the cost of the seasonal permit from $100 to $85 in 2024 for vendors or food establishments that do not operate at the farmers markets.
So this is what we talked about
Yeah.
last fall, and these are the codes we suggested them, and this is the part that the commissioners
They misunderstood our intent.
didn't understand the intent, but now they do, and they
Yeah.
passed it, so you're saying?
Yeah, they voted
That's
unanimously
outstanding.
March 29th, so yeah.
With just a few changes to some of the amounts.
You can operate at 3 markets throughout the year. starting in 2024, and you can operate at 1 to 3 markets for $100, or 4 to 6 for $200.
Okay, so I'm curious about a vendor that's actually outside of the city of Bloomington's market, but across the road off the Beeline every Saturday. And I'm wondering how that permitting process works with that person who's not really at the market, but is there weekly, but is not within the market bounds.
And they might have a seasonal permit for that market location, but it's outside the farmer's market. They just might be
Okay,
proximity close to the
so,
farmer's
so
market.
it's about propinquity.
Well, for that physical location they're at, they probably have a seasonal license for that
Okay,
location.
I was just curious because it's like, well, but they're not in, and so,
Yeah, but proximity is very
Okay.
close. Yeah, it's right next to Beeline across the road right there.
There. Any other questions? So. You don't have to do codes again for a while.
no,
Coming up, well, we will be doing some soon, but the new license from the state's coming soon, so we're looking at early 2024. So
Okay.
we'll be making adjustments then.
Okay. Anything else? Any questions for Mike?
I
Thank
said
you.
you're really busy.
It's been a,
We all are, so yeah. Each department.
Yeah,
been
but
a-
just, with the markets all beginning.
Oh, it is at the
Yeah,
very,
yeah.
the festivals are coming up, the
Yep,
markets,
yep.
yeah, and like balloon festivals and also the local events going on
Yep,
throughout
yep,
the
I assume
community.
you're very
It's been a
busy.
journey.
It's our
This
business.
is our job.
a successful journey now, though.
Yes.
That's good.
I'm just glad you didn't have to redo all those permits.
Yeah.
Well, that's for 2024, yeah, we're kind of, we
Yeah.
passed that, so yeah,
No,
we're already going to the season, so
To
yeah,
go back.
yeah,
Okay,
I
yeah,
do too.
great.
We all are.
Okay, now we have to talk about all these jobs.
Oh, yes, I do believe Kim is online.
Is she?
so, Yes.
We
Thanks,
see
Mike.
Kim? Where is Kim?
Let's see. Yeah.
Yeah.
TSD, can you promote Kim Shell?
There you go.
I wish they were bigger.
Okay. So. One of the things, one of the missions lately has been trying to get the job descriptions to match the jobs.
That has been a mission.
Yes, and also change a couple of things around. To make things work better. Do they have this lovely picture? This is- I love the color code.
It should be in, yes. And Kim is, yeah, promoted now, so.
Yeah, it's in there, but it's not as pretty as this one there. This was much prettier.
Mm.
If anyone wants to see the pretty version, I have it. So,
No, that's an old, well, that's not the one that Kim has, so that is the
this is what we
official,
worked on last time, right?
yes, yes. So Kim is in
Not the-
charge
not the
of
pink one.
creating those. Mhm.
Okay. Okay, so how do you want to do this?
Well, Kim, would you kind of like to lead the conversation on this, or?
Sure, anytime the, wait a minute. Can you hear me? I had my
Can you-
mic on the
Can you
other
tell us
side.
What your actual job is? Kim, are you there?
I'm having trouble.
I can see you from your mouth up. Can you tell the board what your position is with the county?
I am the county council administrator. And I take care of making sure that the job descriptions are accurate, up to date, help departments to go through the process of making changes, that kind of thing, and helping them go through that process with regards to submitting forms, the required forms to PAC, and making sure we got all of the documents in place, so.
So the council is the one, not the commissioner, the council is the one that controls this.
Correct. That is, yes, it is the responsibility of the county council with regards to job descriptions.
Great, thank you. Carry on.
Okay, so, we have a process, and we use a third-party administrator to evaluate our job descriptions, and that's how we get the classifications, the levels, that kind of thing. And so when a department wants to make a change, there are steps. I mean, if you want like a brand new position, there's certain forms that have to be submitted. And I gave you had one of the gals print off. It's called a PAC Policies and Procedures.
Yes.
And that's just kind of a little synopsis of our maintenance program that we have that's been approved by the council, and it was approved back in November of 2021. So if you're wanting to create a brand new job that's listed on this two sheet piece of policy and procedures, if you're wanting to amend a position, or if you're just wanting to add an already existing. So like if you wanted to add it like another administrative assistant, you already have the job description. That's a totally fiscal impact. So that, that would have a different type of forms and stuff. So that's kind of it in a nutshell. So
Right.
If you have any specific questions to like certain jobs or anything like that.
So where are we going from here?
Oh, yeah, I was gonna say, I think the health department was wanting to make some adjustments to certain job descriptions, so the board would have to approve her moving forward with submitting those changes, and I would work with her on what forms needs to be completed and signed off on and that kind of thing.
I'm confused because I thought that we had already done that as a board.
Sort of,
We
but
did,
not really.
Yeah, we haven't.
we endorsed her moving forward to talk
we need
with
to
council
look at
about
these
that.
Again, more specifically.
Okay,
We have the actual forms and the actual descriptions in front of us at this point.
okay,
We did talk about it, we didn't actually do this part.
okay.
So the first one we have in front of us is. Tell me this is this one, what is that one? This is for the temporary position, we want to make that a permanent position, is what we want to do.
Yes, the request is to make the temporary position a permanent full-time position, a senior universal position, and have two part-time universal positions that would report to the senior universal position. We currently have funding for 3 part-time staff in the environmental. They should be covering all areas at that anyway, so the thought process is that they would move to the universal, since they do provide support and administrative help to all areas in the environmental section.
Who they report to, is that part of the job description, or is that an internal thing? I mean, does that have to be part of the job description, who they report to? Kim?
Yes, that has to be, that is a specific line within the job description as to who they directly report to.
Okay, great.
Now Kim has looked at all these, right?
Yes.
So you've reviewed all these, right, Kim?
I
You don't
did
have-
understand
You
you.
don't have real issues with any of these?
She's asking if you've reviewed all of those.
Some of them, but I don't know if we went through them all. I know there were, I wanted to check with Lori with regards to the forms, with regards to the temporary moving to a full-time. Because that would be considered a new job description, and we would have to create that, and there's a certain WIS form. And WIS is our
That should be
third-party administrator. And we would need to ensure that that form was completed properly.
Okay, so the first one we have is for that position.
Mhm.
And I read through all this stuff.
And for those who might not know what a WIS form, like I didn't know. A WIS is the, if I'm correct, Kim, the consulting company who created these job parameters that we have to.
Yeah.
Form to.
Right.
Yes, they're our third-party administrator, and so they have certain forms that go along with, if it's a brand new creation of a new job, there's a form. If it's a review of a current one, there's a different form.
Okay, so this first one we're looking at is for the temporary environmental health specialist to become a full-time position, basically.
It is a full-time position currently, so it would just become a permanent position.
Permanent position.
Mhm.
So, and it fits on the, it's on the little, on the lovely form, and this changes its job classification, basically.
Mhm. Correct.
And this is all filled out and looks good to everybody. You and Kim have reviewed this, right?
Those would be the ones that were submitted the first go around. I have not officially filled out forms though for the discussion on the clinic manager for those.
So this, I'm just talking about this one.
But yes,
This one.
yes.
One is okay. And
Yes.
so what action do we need to take?
The board needs to vote.
Okay, so y'all looked at this, it's in your packet, y'all read it. Any questions or any problems with it?
So I would move that we, if no one has any, we'll do this first, then see if there's more discussion. I would move that we make this part-time position,
Temporary
Hey.
position.
or temporary position, a full-time
permanent position.
permanent position.
I second that.
Okay. Any question, any comments? Okay. All in favor, say aye.
Aye.
Anyone opposed? Outstanding. That one's done. Next we have the certified Indian navigator. So what's this? This is just describing the position. Now, why is this here? Because there's, they didn't really have a job description for, is that it, or what was the problem here?
No, that does have a job description. So that is the one that we are having the discussion on whether we're going to refer those services out, whether we are going to create a new job description essentially that combines those and the clinical
So
or
this is just for information at this point.
that is correct.
Okay, we're setting that one aside for a moment.
Okay.
Next, we have administrative assistant. This is.
I just have one question regarding the
We'll get back
navigator.
to that one when we get, yeah,
Oh, we'll come back.
we'll come back to that.
Okay,
We're setting
okay.
aside temporarily.
Okay.
Right now, we're doing the administrative assistant position. And so what we have here is what the current description, is that it?
That is correct. So that is based upon a conversation about considering whether those updates need to be made to that job description.
Okay, so we don't have any, so what do you need from us in terms of this? Because one thing we discussed in the meeting,
Mhm,
the couples had a meeting with Kim a
mhm,
couple weeks ago, so, and so this is something that
mhm.
you feel that this needs to be updated to reflect what your administrator says it actually does.
Correct.
But we don't have any suggested things for us to review at this point. What do you
No,
need?
so that's just more like
So
an
you-
open discussion. And then if Kim has specific feedback on that, I did talk to Kim a little bit, kind of what the thoughts and ideas were around the position originally. And Kim, correct me if I'm wrong, but some of those duties were assisting with payroll and assisting with claims and be able to be some of those support services. So whether those need to be actually identified in the job description moving forward.
That,
So-
because at
Go
one point in time, there were 2 administrative assistants. And Penny Cottle came and asked for a financial manager. And so one of those administrative assistants was updated and changed into a financial manager. So those like the payroll, the invoices, that kind of thing, all went to that financial manager position.
Okay, so that's why all that stuff is in here then. So. And we have a different job description for financial manager, I assume,
Yes, we do.
so that one, we're good with that.
Well. I mean, I personally, so I think that several job duties were kind of lumped into that financial manager position. So I think it's about creating a clear, streamlined path forward about whose job duties and responsibilities, who are taking on those tasks.
So what we really need to do maybe is look at both those side by side and make sure those are what they're supposed to be at this point.
And that's what I would do. I would recommend, because you don't want to have like a couple, two people doing the same job and not knowing if who's actually the responsible party. So, you know, you can have one be the responsible and then the other one would be like assist or be the backup, you know, that kind of thing. So
So we don't really have to take any action on this.
Correct.
Other than say, go forth and make good job and bring back this when you're ready.
Correct.
Is anybody monitoring the chat? Because there are chat questions. Things a chat question came up, but I didn't get it all.
Yeah, it says, did the county not just pay hundreds of thousands to have all these redone? The board has no idea what actually happens inside the health department, and it shows.
Okay, thank you. Okay,
With that.
now. Now we're going back to the navigator.
I don't know if Jamie can check the chat. Right?
So are there any questions?
Thank you.
So. We have a bunch, we read through all the information about how to become a navigator and what requirements are. There are many pages of this. So, and these are here,
For the insurance navigator documents.
yeah,
Those are there for review and I think just a better understanding of the current situation that we're in.
Do we know what we need to take action on and what we don't?
say that again,
Do we know what's in there that we need to vote on?
that's what I'm getting to.
Ah,
That's what I'm working on
okay,
this.
that's what
I'm
you're
doing these
doing.
one at a time to see, some of the information, some things we have to act
So-
on.
Would have been helpful, I think, to have these separated before the meeting as to what needs action and what is simply for our information.
So. Currently. Our current navigator is certified by the state, but not federally, right?
Correct.
And. Then that's one issue. And the other question is, do we really need a navigator? And issues surrounding that.
Well, also, and if we refer out the navigator duties, do the funds go with it?
No. You mean, so our grant funds?
Yeah, I mean, do grant funds, if we refer out navigator duties and it's asking for a navigator, mandates a navigator, it would seem that funds allocated for the navigator would go with the navigator position,
They do not.
or whoever does it.
So they do not determine who we staff with those funds. They don't get involved with the HR aspects of that. They just say that if we are not, we have to have someone who can bill, who our billing is done by the clinic manager. And if someone needs assistance with enrolling in insurance, if we are not able to do that, which legally we are not able to do that at this time, then we have to refer that service out.
Good.
And we determined that the navigator doesn't see very many people here, and it's probably money that we better spent supporting the clinic in other ways, assuming we could do it with the grant funding, the way that the grants.
Correct. And I think there's a large concern that we cannot be assisting with this process right now from a legal standpoint.
So we can't be doing navigation right now because we don't have the appropriate certification.
Right, and we are not an application organization, which is required.
Okay, so the obvious solution is that we eliminate the navigator position if we're allowed to do that with the grant funding, which is what we've been. Molly, the county attorney has been talking to, is looking at the grant, and you've talked to the people at Indiana Family Health Council. And what have you determined?
That if we are not providing the services in-house, that we can prefer those services out to someone else in the community.
I was very confused by her reply, though. I was trying to get at, can you then use Title X funds for some other position that you actually need?
From my understanding, yes, because they're not
think you
dictating.
could. Okay,
Yes.
awesome.
Yeah, that's kind of how I read it as well.
It's really-
Yeah.
It just seems like a fine line. I mean, they've mandated that we have to have it. And then we're saying, well, we're gonna farm this out to somebody else at their expense. I mean, they're gonna have to pay the navigator for who we farmed out.
No, I don't think.
It was
that's
a different grant that,
Is it
I mean, we
different?
wouldn't be providing services which they granted the money for.
Yeah, well, the problem is this all started back in 2010, when Obamacare passed and they required navigators for certain things, and that's when they first, I mean, that's when it all started.
Right.
And over time, things have changed, and I think that the contracts are kind of generic, and they just haven't really so kept up with that. I think the requirement is that we don't have to have them in our clinic, we have to be able to have someplace we can refer people.
Yeah,
We have to
it's,
do it.
yeah, I know the grant, I read
Yeah.
the grant, it says
Yeah.
that we could refer it out,
Right.
but
And,
just want to make sure that were we counting on some of those funds to be reallocated for people,
we basically get a
a more
grant.
useful position?
We basically get a grant, a certain amount of money, and how that money is divided between the various people who work there is up to
Yeah.
the department. They don't have any input in that. We just get a check of the money, basically. And the grant, go ahead, Kim.
I was gonna say, I just think that the duties that are within the navigator job description has to be in somebody's job description. And that's how my understanding, but I need to clarify that with Molly, that's how we get to keep the grant funding.
That makes sense. That makes
doesn't make
sense,
any
though. It
sense
has
at
to
all.
be-
But you asked Indiana
No.
County Health Council, they said no.
They said no.
Well, and somewhere in the grant, I thought I read that we could refer those services out
Yeah.
Yeah,
if we weren't providing.
Mhm. But that, I think we need to get, and I say we, that you might want to reach out to Molly for clarification with regards to that, so. And I
Yeah.
was thinking she
Some
might
of
have
the
sent
paperwork
an
that
email
I'm
or something
using
to that
from What
effect.
I've read.
yeah. Because I know that Molly is concerned about that.
right, and, so I do think there are, and we could, I have talked to the clinic manager about shifting some of those duties and responsibilities. They're already covering all areas of the clinic as it is now. They're extremely small but mighty staff. And, right now, it's not something that he feels that he can take on with everything else. We could create a new job description. We only have around $7,000 a year. So I think it becomes troublesome of how we are going to financially afford to have a full-time navigator on $7,000 a year.
But it could be part of somebody else's job, though, right?
Yes, it can. And then if there's gonna be the expenses and the reporting with becoming an application organization and all of the required monthly reports and quarterly reports. So that on top of a clinical assistant who's making $14 an hour, I think is a large ask.
So,
But my understanding is that your assistant person is part-time hourly. Is that correct?
Yes.
And you can set your part-time hourly rate to whatever you need to, as long as it's within that range.
Yes, and I am working on getting that, because you all did approve the part-time pay structure. So increases with that. So if we currently have $7,000 a year now with the grant funding to support an insurance navigator, with now increasing the salary, that's going to further increase the annual amount of money that we have, which again, I mean, it's the overall budget. It's numbers that we're talking about here, trying to stretch that, which when we don't have an insurance navigator working now, the services are referred out.
I mean, it sounded like in our last conversation that the number of people that we are seeing with the navigator is like zero. So it's pointless for us to be an agency for navigators when we don't have the need. And it can readily be referred to many navigators in the community without losing our grant funding. So I'm not sure I understand.
well, because I think the bottom line is the county legal does not necessarily agree with that opinion. They feel that our current grant, we had a position of navigator in our current grant, and then to get rid of it in our current grant is not that we can't do that. I believe that's how I interpret it.
But
Should we table this? With the understanding that we can't resolve this because
No.
we believe IFHC allows for that money to be redirected. Seems like IFHC needs to have a conversation with legal and you, and I'm
And
not
we had
sure
that conversation.
we can
We had that
do
conversation.
anything about this.
I think so, and I think there needs to be a conversation on whether we're going to continue operating illegally or whether we are going to become an application organization. I mean, we can't have someone doing those services right now.
Because we don't have federal
Well,
certification.
It's not like we're way out of compliance. It was actually Sarah, one.
Oh, I'm sorry, I missed it.
Yeah. It was one person.
Yeah, so, now, when is the next grant cycle for this? It's soon, right?
Mhm.
So the real question is, can we just kind of like put this off until the next grant cycle?
I think we could.
And make sure that we have the grant written to reflect what we really want to do. And it's not. And not be in conflict with anybody, except for right now, our navigator can't really work because he's not certified.
Correct.
And can we get,
And we
a-
really don't want a navigator, so why go through all hoops at this point? Although, I mean, I don't know what he could do something in the clinic, can he? I mean,
Yes,
okay.
clinical assistant duties. Yes, so those
he
can
he
be
could do,
other duties.
he could do other duties.
He doesn't.
and can we get a second or third opinion on whether the grant demands that we do the navigator position
Okay.
and check with other counties or states to
Actually,
see.
if you, in here, Lori's had an email from the Indiana Family Health Council that says, no, we don't
The
have to have a
funder
navigator.
already said.
The
we don't have to
problem is
have
our
the
current,
position.
problem is there, our current grant has a navigator position in it, so it's funded with that position. We can't just get rid of it in the middle of grant year. However,
Right. If we're putting it in a grant, then.
right, so, but the grant year is almost up, and so there's another one coming up. And so we can change the next grant to not include that, and then we'll be all legal. Does
Okay,
that make sense?
yeah, and then we have to do something through council to eliminate that position altogether?
I think we could just.
Kim says yes. Kim
Yes,
is not- Yes,
yeah.
we have to eliminate it.
Yeah, you just need to inform the council that this position is no longer going to be needed. And so then that way it's archived and not available for use.
Right, but we can't do that until we can actually do
Right.
that. And then there's this lovely list of places people can get navigation.
Yeah, we have tons of them. I saw that.
Okay. Does that cover all our job stuff? No, yes, no,
Yes,
yes.
except for the org,
Yay.
Go ahead.
Kim was gonna make some adjustments to the org chart.
Organizational chart, this lovely thing.
Correct.
And what we're doing is we're adding,
And we might want to hold off on that until we figure out the administrative assistant job duties and see how that comes back. Because I didn't know, now,
right,
or you can correct me if I'm wrong, but I thought we were talking like she was going to be, or him, you know, he, she, was going to be like your right-hand man person. So that like if you're not there, they would go to your administrative assistant. Now, am I
right.
saying that correctly?
That was one of the,
Yeah, we did, we
things-
talked about that a minute ago.
mhm.
Yeah, so updating the administrative assistant job description to actually reflect what the job actually does,
Mhm.
which is a lot more than
Yes.
what it says on that paper.
Yeah.
Yeah.
Okay, then you'll get back with us on those ones when those are ready.
Yes,
Okay, anything else, Kim? Can you think of?
No, I'll just work with Lori and we'll just
Yeah.
make sure all the forms are updated and what is needed for the next PAC meeting.
And there's really no action the board needs to take on this at this point in time,
correct,
until you have actual job descriptions that you're gonna submit to council.
correct.
Excellent.
Thank you.
Thanks, Kim.
All right,
Thanks, Kim. Good to see you.
all right.
Okay. And, but there is this alternate work schedule policy that do we need to do anything with this?
Yes, so the board does need to vote on this.
Did you do Friends of Lakeland Road?
Not yet. We're still on the jobs. We'll get to that one.
Business.
Oh, wait, that's
We're
later.
on
Okay, you're right. That
business.
is later. Never mind. We brought that up earlier. Okay. We'll do that one later. Now we'll do Friends of Lakeland Road, George.
Short and sweet. I emailed everybody what amounts to my report. It's basically stolen from the website for the Friends of Lake Monroe. It reports activities recent and projected into the future. And it's my duty as liaison to lay that on you, and you have it.
Okay,
No action required.
Thank you.
great. No, I'm just updated, our water. The most important public health. Yeah.
There are a few little things that are related to public health, having to do with grants that they're giving out for people who are installing septic systems and improving waste handling around the lake, on the lake floor. That's probably the most immediate one. The other one is the Houston project that the United States Forest Service has been told to go back and reevaluate because it is a source of potential chemical and sediment contamination for the lake. And they hadn't really done as thorough a job as they should have, and they've been told to go back and look at that again. So that's drinking water for 120,000 people around here, so it's a public health issue too.
Absolutely. Okay, thanks, George. So next we have our beautiful annual report.
It was beautiful.
It's
Yes.
beautiful. And I appreciate all the hard work that you all did on it. And it's great. I did not get a chance to look at all of it because we just got it this afternoon. so
Yeah. I didn't look at any of it. I didn't even know I had it.
All of it.
It just came, we just
It
got it
was
this afternoon. so
fabulous. It gave great information and it was just beautifully
Yes.
presented.
It is
Yeah.
gorgeous. We don't
Usually,
need to take any action on that, but
it's
thank
always
you.
good
Thank you all
reading.
so much
It
for
is.
doing this.
It
Yes.
is. You always learn something.
Yeah.
You do need to vote to approve that.
Oh, we have to prove it. Okay, so.
I move that we approve the annual report.
I second that.
And see, okay, all in favor?
Aye.
Aye.
Any opposed? Good. Next, we did the moms, now we have the alternative work schedule.
Oh, yes. So this does have to be formally voted on. So this has been reviewed by the legal department with the HR personnel for the county as well. So the intention with this and the ask is that the health department can implement an alternative work schedule policy for all full-time employees. The purpose is, well, number one, work-life balance. Honestly, I think typically employees work the 8 to 4. Those are our normal operating hours with a 1 hour lunch. Of course, we have many field staff, so hours can flex outside of that, maybe on the weekend, sometime later in the evenings with meetings and whatnot. This schedule, this policy for a schedule would then allow employees to set a set schedule within the hours of 7:30 a.m. to 5 p.m. They would be working with their direct report to create a schedule that is still providing the services that we need to the community, that is still providing coverage for their section, but also allows them to maybe adjust their working hours. So if they have children that they need to drop off or pick up from daycare, maybe they can come in a little bit early or stay a little bit later as needed. So this would be subject to the direct report approval and then my approval, and then the health officer would oversee that as well. The initial stage would be set with the 4 weeks, kind of like a trial period to see how it works. And then a later extended coverage could be approved beyond that. So as you see, there are lots of additional details. I think what's really important is that this is, it does allow for some flexibility, but we still have to make sure that we're providing coverage for the department. Let's see, they can be terminated at any time. Division leaders are responsible for ensuring that all of the programs do have coverage during the department's hours of operation. And this will become a fixed work schedule. So if, for example, an employee says, these are the hours that I want my alternative work schedule to be, they can't be on the 4th day of the first week of the pay period and say, no, I want to change my hours to this. If they want to make any changes, it would have to occur within the next pay period. And then you're going to be set at a certain number of changes that you can make throughout the course of the year. Let's see.
I have a question about.
Yes.
On the minimum requirements of hours.
Mhm.
If they get a start time no later than 11, but they have to be done by 5, that only comes out to 6 hours.
Right.
How does that work?
Well, again, so we have a lot of field staff. So we have a lot of staff who do have events maybe, or meetings that run later. So essentially some days you might have a 6 to 7 PM meeting. So those are still work times. So that would get added onto your normal work times. And then essentially those hours would have to either be flexed out or reduced another day or the following week to be able to adjust those hours within a pay period. We are also changing our pay system into an automatic, well, an AOD is what they call it. So it's becoming even more structured within that 35-hour period per week. So it just really has to do with those employees who are spending time working on the weekends or in the evenings because of their job.
So how does the trial period play into the period by which people are paid? Is it going to be 1 week or a month or?
4 weeks, the
4
trial periods, yeah.
Okay. And
So
then,
4 weeks.
and then the decisions will be made as to final
Correct. So
disposition.
So maybe if the employee and the direct report say, yes, this is really working well. I think I would like to I'd like to try this schedule for the next 6 months. Then the agreement would be made that for the next 6 months, this will be your set work schedule.
Thanks.
So do we need to do anything? Do we have to?
Yes, you need to.
We need action on this. So we need to accept this. I need a motion to accept this as written.
Move to accept the alternative work schedule.
Second.
We have Aurora and Sarah. All in favor, say aye. Anybody opposed? Nope. Okay. Next thing I have on my file here is a hearing screening things. This is for information, I assume.
Yes.
Okay. All right, good. Hearing screening is a good thing. You can hear, you do better in school. Okay, I've come to the end of my papers here. So the next thing we have, is there anything we've missed before we get to the Senate Bill 4?
I do not believe so. No.
Okay. Thank you. Next.
Okay, so I think as all of you know, a couple of meetings ago, George and Sarah and I were asked to take more of an in-depth look at Senate Bill 4, which is the bill that would fund the Governor's Public Health Commission report and pretty drastically change how health services are delivered in Indiana. There had been some concerns expressed, I forget at which meeting, it was a while ago, from citizens that this was not a good thing. And so we wanted to dive into it ourselves, learn as much as we could so that we could come back to the board with our report of our findings, which is what we're doing now. So I will just kind of give a brief overview and then I'll see if George and Sarah have anything to add. Between the three of us, we tried very hard to join the live stream committee hearings that were going on in the legislature and in the committees. And those were fascinating. We did read the report. I read the bill itself, several of the amendments that have been passed by the Public Health Committee in the Senate, and then by the Public Policy Committee in the House. And so it's been really fun work, and I want to thank all of you for letting us do it. It was amazing. So essentially, we did not find any of the concerns that were expressed by the public comments at the previous meeting, because counties do have the option to sign on to this expansion of their services and get more money or not, and they don't lose anything, they will still get 100% of the funding that they're getting right now. In terms of what we understand, the bill, like where it is right now, it might even have been passed by now, I don't know, but it has come through a couple of conference committee changes, and it has come through Ways and Means. It seems to have a price tag on it of 225 million, which is less than what was requested. I think the initial request was 242 million, so not a lot. A couple of substantive changes to the original bill. It looks like they have removed the requirement that the state have regional offices, and I think their feeling was if we remove the physical structures, that can reduce the money needed in the bill, but they're still keeping the regional framework. So it looks like the state will have regional folks that a group of counties will be able to relate to for assistance and for local epidemiology, and certainly if there's an outbreak. They seem to have added some taxes on tobacco, alcohol, e-cigarettes that would provide funding in the bill. So it seemed as though they wanted to make sure there was sufficient funding. It also looked to me like one of the amendments had gotten a little more specific with how much funding would go toward which group of services, because there's one amendment that says 60% of funds, if a county chooses to do this, would need to be spent on this service, there's 40% on these services, and they delineated them. So I think if the time comes when we're ready to get the money, if that decision is made, we would have to just align whatever it is we're doing now with those 60-40 and see how it shakes out. There were only minor changes made to the original bill as submitted. It had to do with things like board composition. We didn't feel like anything in there was anything that we had concern about. And conversely, we felt like it was a very good step in the right direction. And I think all three of us felt very positively and about learning more about it. And so I think in conclusion, and then I'll turn it over to my colleagues.
In response to your thing, it appears to have passed.
Yeah.
That's both the House and the Senate today.
It was supposed to come up today.
Yeah,
It apparently is passed.
okay. And so we would, when the time comes, and we can certainly think about this later as a board, but from everything that we saw in it, it looks like it would be a very good thing for Monroe County to apply for.
And probably the commissioners, the ones who make the decision whether we take the money or not. And
Do we have a role in telling the commissioners we support it and that we
certainly can,
I think,
if we want to do that.
I think the initial concern was some loss of local control possible, and maybe that's not an issue, but that was one of the things
That was one of the things
concerns,
expressed.
yeah.
We did not, do either of you want to speak to that? I did not find that in my,
I didn't think that was an issue. There was, as you already pointed out, the question of the offices around the state that were removed, which could conceivably have been a sort of a cat's paw by the state in reaching into the organization of the public health services in the state beyond that of the Indiana State Department. I don't think that that's an issue any longer, and I'm not sure it was really
and really,
initially either.
all of the services that are in the bill are things we're doing anyway.
Yeah,
It's everything that's there is what we're doing anyway. It would just be more money for us to do it, expand it.
Did
Do
you see what
it
the most
better.
recent
Right.
fiscal line was? I didn't.
I'm glad to hear it.
225 million.
So they actually. got that number.
Yes.
Wow.
Yeah.
Yeah, the
Sarah?
last time that I added up when we had the 240 million, whatever it was, it sounded like 35 cents per person based on the statistics that we have from 2020, which of course are bad statistics, but nevertheless, if we take what we think is the state population, it would be 35 cents for each one of us into health. And as the moms were presenting, we found like a whole section that we could find monies in that 60% that have to be allocated for certain things, that we could actually assist in getting locks for guns or helping educate and spreading the word on things that are truly health related that matter to the health and safety of the citizens of Monroe County, which I think is our job. So it would be a bonus to us. And unless something really weird happens in the next sections and somebody like suddenly comes into the legislature and says, oh no, let's just scuttle the whole thing, or the governor suddenly says, oh, I'm going to veto the whole thing. We should have at least the availability of some good funds.
The governor supports us, I know that.
Exactly, it was his commission. So I'm kind of sad that we aren't going to see a regional approach where our health department could go to a regional office and say, we need help in epidemiology. Particularly epidemiologists seem to be at a premium, and getting the statistics that we want as soon as we want them to help guide us would be such a bonus, but I guess we have to always go to the state, and that's unfortunate.
There'll always be unintended consequences of anything we do.
But no, there was.
Yeah.
not-
I read the entire bill. I haven't been following it, but I did read it.
Yeah, we couldn't find anything where they were asking anybody to overreach and take over our autonomy at all.
And
Counties who feel that way don't have to participate, like I
do you
said.
recall when it goes into effect?
I think
July.
it's July 1st.
July
That's
1st.
what I was thinking, too. Okay,
Yeah,
well, good.
so
Should we,
should
we
we
don't-
say something now?
do we want to say something to the commissioners about?
Well,
we
I
support
certainly
their taking-
recommend
Yeah,
what
I
we've
think we should.
seen.
I think we should. I
I
would like to
recommend
say something.
opting in.
Yep,
Yes.
Would you write a letter for us to send us commissioners and I?
Yes, I
sign it?
can.
Okay, thank you.
When do you want that by?
Oh, okay.
and I'd be delighted to show up at their meeting and speak. But of course, it's not my role, but I would be. happy
Oh,
to
no,
do
it's
that.
your role. You're on the board. You can do that. You
Okay.
can speak on behalf, if you want to go to the meetings and speak on behalf of the board, you're more than welcome to do that.
If I draft a letter, will you two just take a look at it?
Yeah, and then
Yes.
I
Happy to.
probably have
And
to
then I'll-
sign it, but
No, and then
but
I
you
just,
but you guys
want their help
certainly
preparing
take it to the commission.
yeah, and then I'll send it to you.
Yeah, and I can sign it. send it.
Okay,
Yeah,
thank you.
Absolutely.
Thank you. So
Perfect.
that's
Thank
it
you.
unless there are other
Yeah,
questions.
thanks for doing that.
Thank you. That's
Oh,
great.
it was a ton of fun. I loved
I know
it.
you-
I love
you love
this.
that stuff.
I love this stuff. It was a ton of fun.
Yeah. It was quite a bit of a bill to read when I read it.
It was.
It was quite a bit.
Thank you.
So, as one more thing I want to do, is not on the agenda, and that's, I wanted to, I think it's been announced publicly that Dr. Sharp is resigning after 47 years as health officer. And I think we offer you a huge thanks for the work you've done. And, this.
Thank you so much.
Thank you.
There should be cake.
So does that mean you're also announcing that there is a new health officer as well?
It's already been done in public, but right now I'm just thanking Dr. Sharp.
Welcome. Yeah, it was a pleasure to serve. Been through lots and lots of hundreds of employees, not and lots and lots of board members. Almost without fail. And it's been a pleasure to deal with the people that have served, and you people on this board are certainly putting in your time and effort to keep things going well.
I have to mention that under Dr. Sharp's tenure, we had the first comprehensive smoking ordinance in the state.
Those were interesting days.
Yeah, so, there's been some incredibly health proactive things that happened during your watch, and we appreciate it.
Yeah,
Yeah.
we nabbed COVID's back.
Yeah, well,
coming back now.
we're just hoping it never comes back, that's all.
Right,
And you were there for our first
No, no.
pandemic of our lifetimes.
That's right.
Well, one of the kind of interesting things during the smoking thing was when somebody came in dressed as Dr. Death with a big scythe and gave an impassioned plea. I don't know who was on the board then, but, and then, of course, break time, they all went out and had a cigarette
Yeah,
in the hallway of the.
yeah, all right. So many things have changed. When I first came to town, there was smoking in the hospital and, yeah,
Right. Yeah.
so it's all kinds, things have changed. Thank goodness, things have changed.
Yeah.
So, okay, well, thank you so much. And then the only thing we have left to do is set our next board meeting.
Yes.
So. Again, we'll try to maybe spread it out, a bit, maybe look after July 4th. We better try to get back on our schedule.
I am out of town the whole week of the 24th of July.
But how about the week of the 10th? How's everybody looking?
I'm gone from the 12th to the 16th.
Okay,
I mean, not
How
that you
about the
couldn't do it
20th?
without me.
how about the 20th? How's the 20th look for y'all?
Fine for me.
Okay, now here's what we need to do. We need to set the time no earlier than 5 o'clock. Because we are likely to have a new member who has a day job. And won't be able to come until 5. If that works for y'all,
We're saying July 20th at
Mhm.
5 o'clock.
5 o'clock on Thursday, July 20th.
I even, my calendar even has a little thing filled in already there. I just knew that.
It was psychic.
Okay. Sounds good.
Sounds
So we
good.
have our next board meeting
Thank
Thursday,
you.
July 20th at 5 o'clock.
Unless something comes.
And Dr. Randall's not here, but he is resigning from the board. He has a lot of family obligations that he needs to take care of.
So we will not see him again?
I don't think he'll be back, but you can
That's a
always, yeah,
shame.
we always send a nice note. I'll talk to him.
Yeah.
Yeah, he's a nice guy.
Oh, he's so
See what I say.
nice. Yeah.
But I think we have someone to replace him. We just have to get through all
So the next meeting's at 5. Is your
the.
second- is that-
Yeah. Mhm.
All right.
Okay.
Okay,
Move to adjourn?
I think we're done. We're done.
We're done.
Thank you.
Thank you.